Hemophilia is a genetic disorder in which your body has little or no clotting factor, the substance that forms scabs and stops bleeding. People with hemophilia may bleed for a longer time than others after being injured and internally, especially in their joints. This can damage organ tissue and may become life-threatening. Hemophilia is X-linked recessive. What this means is that it is passed on through the X chromosome and you need 2 X's to get it. A girl with 1 X is a carrier. She doesn't have it, but her kids have a higher risk. However, a boy with 1 infected X will always have the disease. This is why hemophilia is more prevalent in males. In some rare cases you can develop hemophilia, but the majority of the cases are inherited. People with hemophilia may not be able to play sports like football or soccer, because the injuries they could receive would probably be severe. However, exercise actually helps to prevent spontaneous bleeding by strengthening muscles and joints. Some activities that are safe for hemophiliacs include biking, swimming, and jogging. The average lifespan for someone with hemophilia depends on whether or not they are getting proper treatment, but it is usually 10 years less than the average person, or 66 to 67 years old. Hemophiliacs usually avoid blood-thinning medicines like aspirin, and some will carry around portable factor concentrate or wear a medical bracelet. There is no known cure for hemophilia, but treatment includes using the drug desmopressin, this only applies to mild and moderate cases, and factor therapy. Factor therapy injects concentrated forms of factor VIII into the patient's veins. It does give them normal blood, but only for around 2 hours. There are many interesting facts about hemophilia. About 18,000 Americans have hemophilia, almost all of them male. An affected mother has a 50% chance of passing the disease to her daughter. An affected father will always pass on the affected gene to his daughter, but never to his son. There are quite a few cases of hemophilia in European royal families, which is why people call it the royal disease. In fact, Prince Charles suffers from this disorder. Other notable hemophiliacs include Tsarevich Alexei Romanov, Mother Teresa, Genghis Khan, and Abraham Lincoln. There are many organizations that help hemophiliacs, one of them being the Red Cross. Each year, the Red Cross holds a blood drive for people over the age of 17 to donate blood. Another thing they offer is donating platelets. This takes longer, but is a lot more rewarding. One apheresis donation of platelets can provide 5 times as much platelets as a blood donation. On top of that, people who donate platelets can donate every 3 days for 24 times a year. If you wish to help people with hemophilia by donating money, please contact